My name is Crystal West Edwards, and I am a principal at Porzio, Bromberg, and Newman. While Porzio is a full service law firm serving clients in New Jersey, New York, Massachusetts, Washington, D.C., and Puerto Rico, my practice area is elder and special needs. What that means is that I spend a lot of time counseling families, individuals with disabilities, and their advocates on how to qualify for and maintain eligibility for government benefits, particularly the Medicaid program. If you have any questions after reviewing this video, or any questions that may arise simply about qualifying for government benefits, please feel free to contact me at 973 889 4263. There is a misconception that individuals living with intellectual and developmental disabilities are unable to work because doing so would render them ineligible for the government benefits that they find to be essential in order to cover the increasing costs of healthcare. Well, while the latter part is true, the former simply is not. Individuals living with intellectual and developmental disabilities are, in fact, able to work in New Jersey without being concerned that doing so would render them ineligible for those very benefits. We have a phenomenal program in New Jersey called Workability. Workability is a full New Jersey health insurance benefit program, Medicaid program that is, for individuals who are permanently disabled, who are working, and whose assets and income outside of this program would have disqualified them for Medicaid eligibility. In order to qualify, a person has to be between the ages of 16 and 64. They have to have a permanent disability. So again, an intellectual or a developmental disability would count as well as a physical disability. But that disability must have been determined, or what we call deemed, by the Social Security Administration or by a delegate office administered through the state of New Jersey called the Disability Review Team. Once the disability has been deemed, then one would meet the disability requirements for this program. In addition, the person must also work because can't qualify for the workability program if you're not working. And so work can be part-time, can be full-time, or even can be self-employment. But the biggest criteria for this piece of the program is that you have to show that the individual is working, and there is no minimum threshold of what would be considered work. For example, if someone is earning $1 a week working as a restocking a bookshelf for 1 hour of work that was done, even though that's not minimum wage, but just follow my example for a minute, they would still qualify for the workability program. So we just have to show $1 of earnings, and we meet the employment criteria for that program. We have to be able to show that the person has pay stubs. We've got to show 1 month of pay stubs, a current disability award letter, bank statements, and a Social Security card. Why are bank statements important? Well, bank statements are important because it shows whether or not the person meets the asset limit for the workability program. So while Medicaid will look at whether or not someone meets the medical criteria, which is do they have a disability, and also looks at whether or not they have income for purposes of determining whether or not they would qualify, at least initially, for the workability program, we must also look at whether or not the person is over or under the income cap for the workability program, as well as whether or not their assets, their money in the bank, is less or more than the asset limit for the program. So we're going to break each one of those down. The income limit. So for the workability program, while I mentioned a few moments ago that there is no minimum work criteria, so you don't have to show that you're earning $500 a month. All you'd have to show is that you're earning $1. There is a maximum amount of income that one could receive to still qualify for that program. And in 2020, that's close to $60,000 of an income cap. Again, an earned income cap, employment income, to qualify for the workability program, which is really exceptional because this program, while for some may be concerned that someone could earn $60,000 a year and still qualify for Medicaid benefits, the purpose of this program at its core is to provide health insurance coverage for one of our most vulnerable populations, to ensure that even if they have the ability to work, that we recognize that their employment income is still insufficient in order to cover their health care costs. So for 2020, the earned income cap is roughly $60,000. On the other hand, the asset limit for the program is $20,000. Now we're going to compare that to the income cap for the Medicaid program that provides the highest level of services you could provide to a senior, which would be an institutional level of care, a nursing home level of care. For that program, the income cap is $2,000. But for the workability program, it is 10 times that at $20,000. Again, this program is designed to encourage people who can work to work, while recognizing that the earnings and the assets that they may accrue are still insufficient to cover their healthcare expenses. Now, while we have talked about their earned income, what we didn't talk about is the unearned income. Unearned income is income that we receive for reasons other than being employed. It's passive income, things that come in without us technically doing anything. That would be our Social Security benefits, or maybe contributions that a loved one may provide to their family member on a monthly basis to cover their household expenses. That would be considered unearned income under the workability program. And so there is an income cap for those things. If someone is receiving Social Security disability benefits on their own employment record, the workability program will disregard that Social Security income altogether. If, on the other hand, the Social Security disability benefits that someone is receiving are based on the work record of their parent, who may have either passed away, retired, or who may be disabled him or herself, there is an income cap for that program. And the income cap does vary from year to year. And this year is slightly over $1,000 a month. It's more than $1,000, but I use that number as just a threshold. And certainly there are resources available through this site and through government means to be updated on what the annual income cap is for this program. In that $20,000 asset limit, there are certain things that are counted and others that are not. One of the things that is not counted in that asset limit would be the house that someone lives in. Life insurance, to the extent that the cash value is less than certain thresholds. So we initially are going to, and of course, a car for the person to live, to use while they are living day to day, either going to that job or going to doctor's offices that they may need to visit. And so when we think about that $20,000 limit, we think about it really from the concept of it being $20,000 in liquid assets. Each of the Medicaid programs that are available to people in New Jersey have its own unique set of eligibility rules related to income, assets, transfers of assets, resources, sometimes other criteria such as employment or pregnancy status. For this reason, this discussion that we're having now certainly is not going to drill down into the nuances of each of those programs, but I highlight those distinctions so that you take some time to visit what the eligibility rules are for the program that you are considering, taking into consideration that the dollar amounts that are associated with these various programs, the income cap, the asset limit, the resource limit, sometimes those increase annually. For most Medicaid programs, the asset limit will not change, but the income limits will. If you have any questions now or in the future about the Workability Program or any other programs that you're considering for purposes of providing health insurance coverage for you or for your loved one, feel free to contact me, Crystal Edwards, at 973-889-4263.